Let's talk about the care guides. All right, so you've gone into the Spira Care Center, you've had your test or you've had your treatment with the doctor, and the doctor writes out a list of things that he or she wants you to do to prepare for maybe a procedure, or they're writing a script for a medication that's new, and there's a whole list of things you need to do. Take 2 before bed, after hours, whatever those instructions are. And you get home and you say, what did he say? What did she say? I don't know. Instead of calling back and trying to get the doctor back on the phone, that's your care guide. All right, you're calling the care guide and you're saying, I was just in the care center. My doctor gave me some instructions and I'm not quite sure what to do. They will help you with that. They have all of your information. They can kind of help you walk through that. They can do that after your appointment. They can do that as an extension of your appointment. All right, so if you have a new diagnosis and you want to sit down and talk to the care guide, find out the doctor that may be doing your procedure or the hospital where you're having your procedure, they can help you with that. They can price that procedure so you're familiar and you know kind of what that cost of that service will be. So they're available beyond your doctor's visit. They're kind of there to hold your hand as you need to. Is the care guide, is it a virtual person or is it a live person? Well, your care guide is a live person. All right, so it is actually someone that you will see and talk to. Care guides have a nursing background, customer service background, so they have the medical knowledge and they also know how to be warm and fuzzy. But you will actually be warm and fuzzy with a person, but it's not a machine, okay? It will not be in a different country. You're actually talking to a person. Okay, her question is, what are we considering urgent care? And we know urgent care doesn't necessarily fall between those core hours. Middle of the day, you have an urgent situation, it's the extended hours, the weekend, you can walk into one of the Spira Care Centers and still receive care. You don't have to have an appointment, although we prefer the appointments. I want you all to remember, any care that you receive at the care center, this is a kind of a short list, all of your care at the care center is at no cost, other than that generic prescription drug. So after hours, if you have to go to a Blue Select Plus urgent care facility, there would be a cost to that, and we're going to get to that in just a minute. All right, it would be subject deductible and then 100% yes. Kind of think about that continuation of care. So if you do have to have some services outside of the care center, that care guide is still going to make sure the doctors in that Blue Select Plus network to make sure that they know what's going on, make sure that everything is connected. So it kind of connecting all of those dots, kind of that continuation of care.